schools, unfortunately, will, number one, be able to give you that information, and number two, perhaps willing to give you that information. Some schools have that available on their website, and you want to, but sometimes it could be skewed because if it's available on their website, it could be an amalgamation of multiple years or perhaps multiple attempts into the match cycle. So you want to always keep your eye on the big picture when you're applying to international schools from Asia or, wherever in Europe. They will tend to, be more favorable to places like that. So there's not an exact system, but there are filters in place. And also, if you, let's say, went down the international path.
You said that, tell us a little bit about your personal story, you being in the third bucket as a Canadian national. What was your secret to your success? How were you able to, what did you do to kind of really separate your application? Tell us a little bit about, about what you potentially did for yourself.
I have a very convoluted, I would say, but very interesting, and we're recording.
Okay, so, well, hey, Zeel, I wanted to say thank you for taking the time to do this video with me. I wanted to, as a part of LPS Health, one of my objectives is to create like an educational forum where we get other healthcare professionals talking about their experience, and in the hopes that it's going to help others in our community and students at large with decision making, especially within healthcare. Healthcare is, kind of a different beast altogether. There's a lot of nuances. It's a hyper competitive kind of marketplace. And, I get a lot of folks asking me, students kind of asking for advice, especially when it comes to getting into medical school, and then alternative, types of careers within healthcare. So my hope was to maybe interview you. I know you have kind of recently went through the whole process, and you have a unique application that I think could be very helpful if people were to kind of know a little bit about how to navigate special circumstances. And so with that, let me just have you kind of introduce yourself, tell us a little bit about your background, what you're doing, and your pathway to where you've gotten to so far.
Okay, awesome. Thanks so much for having me. So I'm really excited to be here today and sharing my journey. I think it's very important to share the fact that there are definitely many different ways that someone can pursue a meaningful career in healthcare. I definitely think that it's also nice to have representation from someone who perhaps didn't necessarily have the most traditional path. So I was born in India, and I was primarily raised in Canada. I went to medical school on St. Martin, and that was where I discovered that I really enjoyed small communities and just rural healthcare overall. And that passion was sort of further solidified as I did my rotations throughout the United States. And primarily, a lot of my rotations were in underserved populations, and it was very enriching. And after that, I had a little bit of a gap year. I struggled a little bit with some test anxiety, and it took me a little bit longer than perhaps ideal or traditional to complete my boards, but we did get there. And then I went through match, and unfortunately did not match the first time around. And it was during COVID. And as a result of that, a lot of my externships were canceled. Basically, actually, everything was canceled. And being an IMG and doing my medical school in an international situation put me in a unique predicament in the sense that it was difficult to network and overcome those perhaps like non-traditional aspects of my application. However, we did persevere and published several articles, one in the Cleveland Clinic Journal of Medicine, and another one in regarding cardiac catheterization. So I was very fortunate to be able to have various research experience and was able to match into my first choice program in family medicine, specifically rural family medicine. We finished residency, have had the opportunity to pursue global mission trips and the Dominican Republic, doing some work with Haitian refugees, as well as going to a a small village in Zambia, right outside of Livingston, called Mwandi. It was primarily a pediatric trip, so it was extremely rewarding and learned a great deal. And now we're done residency and taking a little break before we start the full-time job as a hospitalist. So as you can see, I had a lot of adventures and roller coasters in my journey. And I
Yeah.
do think that there are a lot of people that are perhaps currently in a similar situation.
Yeah, it's actually interesting now. The definition of a conventional student is really changing. Even if
Mhm.
you're here in the U.S., I'm realizing that only 15-20% medical school classes are filled with students who have just graduated from undergrad. So majority of the students are taking an alternative pathway with gap years and stuff. Specifically, one of the questions that I get a lot is, when, if your application is, if your application is not great and too strong, when should you, or if, when should you decide to consider going to a Caribbean school and or an international school? And how competitive is it nowadays to be able to get a residency coming back? Um, Tell us a little bit about even passing the USMLE Step 1 exam and some of the parameters that you should be looking at before going to consider a foreign medical school. Because, I mean, truth be told, a lot of schools will admit patients, and, the foreign medical schools are not necessary. And me having gone to one, one of my worries was like, well, how do I really know if they have a vested interest in me actually passing my board exam, as opposed to just taking my tuition?
Mhm. Yeah, that's a very nuanced question. There's so many factors to it. So I definitely think that an international school, whether it be a Caribbean school, whether it be, we have a lot of applicants from Poland versus like some other ones, India, Pakistan, wherever, basically any international school, you do have to take a lot of factors into consideration. So I do agree. Like I have noticed and being on the other side of it that a lot of the applicants that we're getting and a lot of medical students do end up taking perhaps a non-traditional path. So we can touch on that briefly. So let's say you choose to continue to pursue medical school and your initial choice is to pursue it in the United States. I have seen that some people pursue alternative degrees, whether it's like an MPH program or perhaps like another bachelor's. I think the primary reason for that is very much networking based because a lot of times the faculty in MPH programs do overlap with MD programs, and that tends to provide a little bit of a foot in the door. I would say a majority of the people that do take perhaps a little bit a year off and then reapply primarily choose options that allow them to have a little bit more face time, whether it is through an MPH program, whether it's through research, pursuing a master's in whatever form of research that you wish to do, especially if you are interested in applying to a residency program or a medical school that is very research based and research heavy. That is another way to get your foot in the door. I think that there's probably a lot of other ways that people are pursuing that right now because I'm a little far removed from like applying to the medical school process right now, but I can definitely speak to the international aspect. So if let's say you've tried your options or those options are not feasible for you for whatever reasons, and there could be a variety of different reasons why you're choosing to perhaps forego taking a little bit of a longer path to potentially get into an American medical school and you're looking at international options, I would say that it is very valid to be concerned that the school that you're going to, like, do they have a vested interest in me? Am I just a number? Are they gonna take my money and like fail me out? And that's extremely reasonable because there are a lot of international schools and it's difficult to determine perhaps credibility is not the right word, but I guess that's the closest word that I can say, the credibility of a possible program, like a possible medical school, just because there's so many factors. Like, for example, I could speak to Caribbean medical schools, just because there's now hundreds and hundreds of them available, and the stats, when you see the stats, it's difficult to find objective stats that aren't skewed in the favor of the medical school. Not to say that that's necessarily a bad thing, but it's important to be mindful of the biases that are that are present in statistics. So a lot of times, if you go to the school's website, you will see favorable statistics, and that may or may not be entirely accurate because, of course, these are for-profit schools. So it is your money and the financial is a very big an important aspect to them. So one way that you can see how good that a school does is you can look to see, or you can ask them even like how many of their graduates go on to match and what percentage of each class goes on to match. And if they do go on to match, does it tend to be their first time, second time, and are they tending to be in primary care or do they pursue different specialties? If you do see that, if you do have a idea of that and the school does provide you with that information, that provides you with a little bit more information to go on, because not all schools, unfortunately, will, number one, be able to give you that information, and number two, perhaps willing to give you that information. Some schools have that available on their website and you want to, but sometimes it could be skewed because if it's available on their website, it could be an amalgamation of multiple years or perhaps multiple attempts into the match cycle. So you want to always keep your eye on the big picture when you're applying to international schools, because it's not just a matter of getting into medical school, it's a matter of like, are you actually going to get where you want to be if you go through these medical schools? And specifically being in the Caribbean, there's definitely tiers. I would say like right now, as far as I know, there may be more, but for the most common known one, the best known one is like St. George's. It tends to have like the best reputation amongst residency program, has a very good it has a very good match rate. Also, but you know, there are people that who do go there who may not necessarily be the best test takers. They do have a reasonably like a reasonable attrition rate, and there are people who do struggle through that. With regard to their resources, I'm not entirely certain because not all Caribbean schools will provide you the same degree of resources. So if you are someone who perhaps struggles with test taking or struggles with anxiety or things, the ability of the school to provide you with the resources really, really varies. And so you may want to look into that if that is something that's applicable to you, because if you, quite frankly, if you're not a good test taker, it will be difficult for you to successfully navigate the international pathway. So you want to be mindful of that and be aware and realistic with yourself that if you're a good test taker, that the probability of you getting through an international school is quite high, because a lot of it is very dependent on your scores. This, as you were asking earlier, the USMLE requirements have changed. So previously, the step one score was weighed quite heavily, and now it's pass or fail, which is disadvantageous for international medical graduates because it provided an opportunity to set yourself apart initially. However, now that it's pass or fail, I think the buck has sort of passed to step two CK, and that you know, it's just one less thing that you can differentiate yourself through, because a lot of times when you're applying to residencies, the fact that American medical grads have that base time with, let's say, a prospective like residency program, because you're in the same hospital, you may not have access to that depending on the quality of your rotations. So that's one thing that may be a little difficult, but again, it does benefit you quite a lot if you are a good test taker, because you can separate yourself with step 2 CK, as well as step 3. Step 2 CS is again pass or fail, so that's not going to differentiate you in any meaningful way.
So,
And
I've had a situation more than once now where a student has gone, particularly to India, and they've spent hundreds of thousands of dollars. They came back and they just were not able to get past step one. And over the years, as I'm mentoring like more and more students, I'm finding you have to use some kind of objective measure to give people some advice and some, guardrails on like, okay, here's how, in generalities, how you can kind of make an assessment. So one of the tools that I've kind of historically used is using in test taking, and I'm a notoriously bad test taker myself. So this was something really dear to me. And there's no correlation, right, between your test scores and how well you're going to function as a physician. Most of the time there's like a inverse relationship between EQ and IQ, or your ability to pass the test, and how well you are going to do with taking care of people. Having said that, I tried to make a correlation between like high school standardized testing scores, whether ACT, to MCAT scores, to the pass rate for USMLE. Um, do you have any kind of insight into saying, okay, look, if you're just not getting a minimum score uh, of like maybe 500 on that MCAT, that you may want to think about, pursuing other things. Having said that, I'm a big proponent on so many other careers in healthcare that can be great alternatives, just as meaningful and fulfilling in all aspects. So maybe you can speak to a little bit about, some objective measures that maybe you can give some advice to like folks saying, hey, in generalities.
Well, so I would say in general, because I wish there was something out there that would be able to correlate, and maybe there is, and I just haven't found it, like the MCAT score to the USMLE score, because ultimately you do need to pass your exams, even if you're a test taker, if you're a bad test taker, like I am, you do have to pass those exams, and those scores are important. And like the reason that people, the residency programs, and obviously I'm sure you know this, but for those of you listening, the reason that people do care about these scores, and again, no one's saying that if you are, scoring quite low, you're going to be a bad doctor. That's not the case at all. But the reason why it's so heavily emphasized is because a lot of the funding that comes from residency programs is quite dependent on the number of residents that pass the board exams for whatever specialty that you're in. So if you are a bad test taker, to the extent that you're going to fail your boards, that can jeopardize the funding for residencies programs. So having said that, that's why, for those of you listening, that's why the fixation is so heavy on exam scores. And it's so tempting to be, it's easy to say that if, oh, I'm a bad test taker, I'm going to be a bad doctor. That's not the case at all. You are probably going to be a fantastic doctor. And if you don't want to pursue being a doctor, you're going to be a fantastic provider in whatever avenue that you choose. So I would say in generalities, I think everyone knows, like if you're someone who struggled with multiple choice exams in throughout undergrad, it's someone who struggled with standardized testing, someone who struggled with the MCAT 2, perhaps even like get a reasonably decent score. Now it's been a really long time since I've taken the MCAT, so I think the scoring is different from when I did it. But I think that, historically you could see a trend. If you're a good test taker in school, you tend to do well on multiple choice exams. You tend to crush standardized testing. It would be fairly safe to say that you are a good test taker, or a reasonably good test taker, to successfully make it through. And if you're not, then perhaps you haven't found your groove, or like how to study in a way that's most effective for you to perform well on that style of question. So I think you would know, just based on your academic performance in university, as well as during any standardized tests that you have to take. I don't know if that's
Sure.
helpful.
No, it's absolutely helpful and so relevant. One of the other questions that I commonly get is, okay, so let's say you go to a foreign medical school and you pass your step one exam. What's the probability of getting a residency now? Nowadays, when I went back about 30 years ago, we had about a 20% surplus in residencies than the actual number of American medical students, who were going to medical school in the U.S. I know funding for residencies has changed, and I don't believe that the number of surplus residencies is that large now. Can you speak to
Mhm.
speak to that competitiveness of getting a residency and what type of residencies are going to be available? Um,
So yeah, sorry, go ahead.
yeah, no, that's
Okay.
basically the question. Yeah.
It has definitely become very, very competitive. I would definitely say being an international medical graduate, it is extremely difficult. If you look at the stats and they say that there's a 50% match of international medical graduates, but even still, I would say that it is really, really difficult. Like even if you passed, like even if you pass step one, it's not really make a difference to your application. Like that's a because it's pass or fail now, that's an expectation. Then you would have to do well on step two. And you'd have to really do quite well in order to set yourself apart. Not only do you have to do that, you kind of have to, this is the way, I think maybe people don't know this. Um, when you're getting interviews, a lot of programs well, so let's just say when you're applying to residencies, you have some programs that will not offer you a visa, period. So if you're an international medical graduate that is an American, you still have like a little bit better chance and you can apply to those programs because you won't require a J1 visa. But if you are someone who's an international medical graduate, that does require a visa, that puts you at a disadvantage because you're not able to apply to all of those programs because they will not even look at your application. Other thing is that there are filters in place. So you would be wasting your money if you even sent in an application in hopes that your stellar application will allow you to overcome that barrier. It won't because they won't see it. Um, the other thing is that when, let's say now, if we just eliminate programs that don't offer any visas, um, the programs that do, and there's still quite a few of them, so it's not disheartening. There are a good number of them that offer visas, so it's still okay. You kind of have applications that are sent out in a sort of tiered fashion. So the first group of people that get the interviews are American medical graduates. They are the first priority, and it I'm not entirely sure why that is, but that is the case. Whether you're a DO or an MD, if you're an American, you went to school in the States, you are definitely first pick, so to speak. After that, interview slots are sent out to American IMGs because visa paperwork is a pain in the butt and nobody wants to necessarily do it if they don't have to. So after American medical graduates, you tend to have American international medical graduates. After you have the American international medical graduates, you have all the remainder of the international medical graduates. And where you fall after that really depends on the program. So if a program has a lot of successful residents from the Caribbean, they will opt to provide they will opt to provide interviews or offer interviews to people that have graduated from the Caribbean medical schools. And then after that would be other programs, sorry, other countries. If you have a residency program that has had very successful students from Asia or, wherever in Europe, they will tend to, be more favorable to places like that. So there's not an exact system, but there are filters in place. And also, if you, let's say, went down the international path and you did not have perhaps the most smooth path and you have like a long time since your year of graduation, and you may also get filtered out based on the threshold that each program places. So because of the filters in place and the fact that there's so many different ways that you can structure the filters, it's it's gotten significantly difficult. But and it's difficult to know because you can't outright ask, and the program doesn't outright state what their filters
Yeah.
are, but you have a general idea if you do enough research. You can kind of tell because other some filters would be first time pass, second time pass. So let's say, you didn't pass one of your steps on the first attempt. That's still okay, depending on the program that you're at. So it's so multifaceted now. So I would say in some ways it's gotten harder, just because of the filters. Even if you're a great candidate and you're a fantastic fit for the program, if your application does not get seen and they don't get eyeballs on it, you just won't even get offered, and that money essentially goes to waste. So a good technique that I would say is to network, 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 talk to as many people as possible, because programs do pull your application. So for example, if let's say I went to a conference and I totally hit it off with one of the residents, and like perhaps like a senior resident or a chief resident, or even let's say a program director or a faculty member, and they were interested in me and my work, and let's say like, my application would perhaps get filtered out. They, based on your ID number, they can actually pull your application out and review it. So I would definitely say if you're in a situation or you're an IMG, it is definitely in your best interest to network as much as you can to optimize those chances.
So having said that, tell us a little bit about your personal story. You being in the third bucket as a Canadian national, what was your secret to your success? How were you able to, what did you do to kind of really separate your application? Um, what? Tell us a little bit about what you potentially did for
So
yourself.
yeah, I have a very convoluted, I would say, but very quickly. So I have a very convoluted way of going about it. Like I knew from the very beginning that networking was extremely important. So I purposefully picked my rotations in multiple different parts of the country. In retrospect, I don't know how effective that was, but that was my strategy, that I was just trying to get to know as many people as possible. Just like trying to experience the different cultures across the United States. And as a result of that, get in front of as many faces as possible. And then after that, I essentially, you know, did perhaps what every medical student does: come in early, leave late, and aggressively sought out research opportunities. So I have done a lot of research, and through that research was able to show my work ethic. And I think that that allowed me to publish, I think in total, like 5 or 6 articles, a couple of which were first author. And through that, and I was able to present my work at different conferences. And while I was at those conferences, I got to go to a lot of networking events and meet a lot of people. So I think that people found me interesting just because of my sheer tenacity, perhaps, that
There you go.
they were
Yeah.
just like, what is she doing here? So sorry. So I think that's what it was. And I think I'm fortunate, lucky for me, like I'm an extrovert, so that wasn't particularly challenging for me. And I know it can be challenging for people who are perhaps a little bit more introverted because it can be very daunting. So that's something that worked for me. When COVID hit, um, sorry, so like I did all that and I had a bunch of interviews lined up. My first time around, and it just didn't work out. For I'm not, you never really know, it just didn't work out. And then COVID happened, so all my externships, my number one personal strength, which is like talking to people, I wasn't able to do that in person. So then I realized that I really still wanted to be a part of, you know like provide some sort of meaningful assistance or help, even though I couldn't be in the hospital. So I created a website called COVID-StatenIsland.com and COVID-19 StatenIsland.com in collaboration with a couple of my attendings virtually. I don't know how to make a website, figured it out. I don't know. And it was essentially to consolidate resources because healthcare workers were so busy at that time, and it was difficult to navigate like all the information that was coming out. So the idea was to provide a simple, user-friendly way to stay on top of it. And that got the attention of a couple of other attendings, and then got involved in other ways. And I realized the power of social media and the internet in making connections. So I decided to create a social media, like to be mindful and actively curate my social media. And at the time, the narrative or the general paradigm was that when you're applying to residency, turn off all social media, make sure you're not on the internet, make sure that your internet's all clean. So what I did was I tried to actually be more active on the internet, tried to put myself out more in a way that curated my personality, so that people who are interested in getting to know me would be able to get to know me, even though they couldn't physically interact with me because of COVID. And I think it kind of worked out. I was fortunate enough to get some great interviews, and my program director really enjoyed that. I have my own website, and I think just putting myself out there a lot more really helped increase like the surface area, basically, of creating meaningful connections online. And you can see now that a lot of programs have been pushing towards having social media presence. There's a lot more doctors out there. So I think that the COVID era kind of changed that about graduate medical education. And you can really utilize that because they're going to look you up regardless. Like if they find you interesting, they're very likely going to look you up to see if there's any red flags or something. Why not use that space to sort of promote yourself, which is what I did. And I think that was a kind of unconventional way, but for me personally, it worked out. But I also did have multiple publications, and I did have several case reports and presentations and all the other academics.
No, I mean, I think that's such a brilliant thing. I mean, just you're out of the box, take the bulls by the horn kind of attitude. I think is so important, and I'm so glad that you were able to share your story with us. I know we're running out of time here, but I just want to thank you for sharing your story. I think you have so much to be able to share, especially with like a lot of Indian students, international students who are kind of struggling with these types of questions. We find that there's not a whole lot of places where you just get this kind of insider information. Having said that, there's more things I'd love to talk to you about, including, hey, what are alternative like options and career options that within healthcare that like most people just don't know about. And maybe if you're up for it, maybe we can do some additional videos along those lines. But I really want to thank you for your time, Dr. Zeel Shah, and hopefully we'll be able to do a few more of these interviews if
Thank you
you're up
so
for it.
much, Dr. Moore. And just a parting shot for anybody who's listening. You're smarter than you think. You're more confident than you think. Just believe in yourself and just go for it.
All right, awesome. Well, thank you. Take care.